phase 0 trials and the triggered trials that we have are basically trials where patients are exposed to drug prior to surgery with the intention to analyze their tumor tissue shortly after surgery and determine if the drug is penetrating the tumor and hitting its molecular targets. If it is, then that triggers an expansion phase of the trial where the patients get treated with the drug long term. So our initial experience with Pamiparib, which is a PARP1/2 inhibitor made by BeiGene in this phase 0 trial, tells us that the drug is very excellently CNS penetrant, perhaps more so than any other PARP inhibitor that's been reported to date, and that it does so in newly diagnosed and recurrent glioblastoma. We also see evidence of the molecular effects of drug target inhibition as well as the synergy with radiation. And we have a handful of patients who have now received the drug plus radiotherapy postoperatively, and we're following them clinically. We're optimistic about the use of PARP inhibition in glioblastomas and CNS tumors. And the reason is that radiotherapy is one of the most effective treatments we do have for glioblastomas. We desperately need to find ways to undermine the mechanisms that resist radiotherapy. And these DNA damage response mechanisms are governed by things like PARP1/2. So effectively targeting it is an important first step. It's certainly not going to be the only step, and we're now looking at DNA damage response combinations to further undermine that.